Margaret has had a phenomenal career. She was, as I said, at the University of Minnesota working on her tenure, and while she was doing that, unbeknownst to most of us, she was going to law school. So Margaret has a PhD in nursing. She has a degree in jurisprudence. And while she was getting her tenure, she and her husband Willie raised 4 children. And we were so delighted that she was at the University of Minnesota. And after she received her tenure, she had the great fortune of being able to get a Robert Wood Johnson Fellowship in Policy. And so she spent 2 years in Bethesda writing law for the senator for whom she worked, then moved on to Yale, and we are just so thrilled that she agreed to come to be at the University at Buffalo. We have as one of our strategic goals to develop a culture of inclusion and respect and collaboration, and that's why we have an assistant dean for diversity and inclusion, and we're very excited to see things happen and move for us. But Margaret has been a good friend and colleague for a long time. She has many more things I could tell you about her. Probably the most important one right now is that her book came out in December. It's the first book on American Indians and Indian health and nursing in the country. So we have a pioneer. Margaret is a pioneer in many, many ways, and so I am very delighted to have her come and share with you just kind of a brief 15 to 18-minute kind of TED Talk today to just tell you a little bit about what's happening with American Indians and health, and what is so important for us to know, and unfortunately what we probably don't know as the dominant culture primarily. So please join me in welcoming Margaret Moss.
I guess it works. So this happens mainly east of the Mississippi, and I was just telling someone I've lived from Washington, D.C. to Washington State, from Minnesota to Texas, and many places in between. And it's very different whichever part of the country I'm in as to whether people recognize me as Indian or not. Most Indians, no matter what the context, the old up nod, they know you're an Indian. But the dominant culture people don't know you're an Indian. So that's the invisibility. That's one of my outcomes at the top. So I purposely titled this Hidden to Healthy, because hide is an active verb. I'm not just suddenly invisible. Somebody made me that way. So part of my first half of my talk is about this hiding of the Indians. So in other words, from dictionary.com, to hide is to conceal from sight, prevent from being seen or discovered, to obstruct from view. And I'm here to tell you that there have been at least 250 years of persistent, sustained, targeted federal policies and laws to hide the Indian. Do people know what I'm talking about mainly? Unfortunately, one of the ways this is hidden is that it's not taught in schools. And as Marcia just said, I have 4 kids. I've just been through the dizzying array of primary, secondary, and post-secondary education with them, 3 of them still in college. And the things that they learn and the things that they don't, it's dizzying when you are an Indian. And they try to write things. Their essays in college right now, they're in 3 different ones. And they're pushed aside and said, no, this wasn't the assignment, when they're trying to write from the Indian point of view. And they're forced in 2016 to write the other way. This is all part of the hiding of the Indian. So as I go around the country speaking, it's crowds, whether they're academic, health professionals, or popular audiences. Very few people have ever heard any of the real histories. These are the things, along with the structures that I'm talking about, that affect and make the health outcomes that we see today. And we purposely didn't do PowerPoints with charts and things. So I'm just going to tell you some of the more stunning outcomes and see what people think. So in my own tribe, again, in North Dakota, who thinks they can take a guess at what the average life expectancy for a male, I know you've never heard about it, but a tribe in North Dakota today in 2016, what anybody think? The average life expectancy in America, largely all US races, well, let's do Caucasian, 81 for females, 78 for males. So are there any guesses on the Dakota? Anybody else? She says 40? 45. 45. In my tribe, it's 49. The worst is Pine Ridge, which is next down below, South Dakota, variously reported 38 to 42. This is the lowest, not in Indian country, not in the US, but in the Western Hemisphere. It's even lower than Haiti. And yet, why don't we know it? Where is it reported? Is it on CNN? Is it in the newspapers? New York Times? New York Times every once in a while trying to, get a prize or something. We'll talk about Pine Ridge. But there, how many, does anybody know, and natives cannot answer, or Tammy if she's here. Anyway, how many tribes are in the US? Anybody? There are 567 tribes. The last one was added this summer as I wrote that book, and if that didn't throw a wrench into all the times I said 566. And it's the Paw Monkey in Virginia. They're the last ones to be added. There are 60 more tribes that are state recognized, but then they don't get any benefits from the federal government. And then there are 100 tribes that were slashed in the termination phase of federal policy in the 50s. So they're just floating around out there. So there are people who are considered ethnic Indians, but they don't have any tribal affiliation. So these things all come into the fact that we are all, I would assume, maybe 90% US educated in this room, and yet people don't know 567 tribes because it's not taught. Does anybody know how many tribes are in New York? I've had to discover this since I came here. Anybody? There's 8 federally recognized tribes and 3 state. And again, I've given this talk to health professionals across the East, asking them about their own states. And if health professionals don't even know how many tribes are in your state, or how many urban populations are in your state, how can anybody be saying they're giving culturally competent care? You don't even know who you're taking care of. If I walked in, I'm sure no one would ask me, because I've done this sort of N of 1 myself throughout 50-some years. Nobody ever asked me. I've had 4 kids and other issues here and there. No one's ever asked me how I identify. So how do they know how to give me culturally competent care? They don't even know who I am. And this happens over and over and over. So this is invisibility. This is why I say it's purposely hidden. It's not in the textbooks. Could be in the textbooks, so that's purposeful that it's not in the textbooks. Nobody asked me anything. That's purposeful. Nobody's asking me anything. So that's the reason we called it hidden to healthy. I didn't want it the passive, oh, I'm invisible. It said things somebody purposely hid facts and issues about American Indians. So here's another, so I'm sort of still at the tip of the triangle talking about outcomes. So we just talked about life expectancy. One of the more stunning areas, which is of interest to me as both a nurse and a lawyer, is the violence against Indian women. Is anybody aware of this issue? This is a stunning issue that crosses both US and Canada. Can anybody guess? I'd love to do that. Times what? Times 1, 1.5, 2? What do you think the murder rate of American Indian women is as compared to women all races in the US? Is there any guesses?
Times 10.
Yeah, he's absolutely right. American Indian women have 10 times the murder rate of the next closest group in the US. Did anybody know that? And if you didn't, why didn't you? Why? Because it's not in the media. And if anybody does know about it, what are they doing about it? So I like to say, has anybody heard of Lacey Peterson? Everybody? Has anybody heard of Ashlyn Mike? Nobody. This is an 11-year-old girl, this week, Monday abducted, Tuesday found dead and thrown away in Navajo. Is it on CNN? Did anybody know it? Lacey Peterson was on the front page for what, 6 months? And so for every dominant culture person that goes missing, many, many more American Indian and African American women are missing, murdered, and it never hits anything. So this is again the hiding, not just by laws, not just by school books, but by the media, by you name it. We're just completely hidden. When I go to scientific conferences and I see the big, I go to gerontology because I do aging, I go to APHA, 3,000 to 5,000 papers are offered in those conferences. Maybe 5 are on American Indians. It's usually students. It's usually a 5-person qualitative interview. There's no information. There is in education, there is a paper or monograph called Beyond the Asterisk, because they found the same thing in education, that there's always an asterisk by the American Indian Alaska Native, and then no information, we don't know. So nothing's reported. So nobody bothered to ask. More hiding, hiding, hiding. So of course there is a big problem with liver disease, with diabetes, with cardiac, as with everyone else. The third cause of death in American Indians is accidental injury. This doesn't hit anybody else's chart. Accidental injury. So now we're moving to social determinants of health. Is there safety? Is there plumbing, complete housing, transportation, income, education? The answer is no, 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 no. So why are people falling or whatever? I work a lot in the Pueblo areas. There's no plumbing. You have to chop wood to heat your homes. I was up on the Canadian, you'll see that one that's called Elder's House up here. That was on the border of the Turtle Mountain Chippewa at the Canadian border. That man's house, if you notice, his wood pile's almost as big as his house. There's one line coming into that house. So if anything happens, people have to fix it. Can you imagine? And he has an outhouse and he's in a wheelchair and he has slats for the floor. Can you imagine how many accidents are just waiting to happen? And they do. Third highest cause of mortality is accidental injury for American Indians. This is all tied to social determinants, which I just told you about. So if we get down to structural, and this is probably the fastest I've ever done this talk, but I guess I bumped into this after my dissertation. And I was doing, there's that elder's house, and that's literally it. He's got an outhouse to the right of his truck and then wood, and he's in a wheelchair. And the snow's as deep as his house. This is the Canadian border. So accidents waiting to happen. So when I went to law school, because of my findings from my ethnography, which I can't get into. It has to do with aging, elder care, and moratoriums and so forth. So I went there, and it just struck me, nothing's really taught. I had to purposely take federal Indian law. And this is true throughout nursing. I've been in 3 nursing programs. The pre-licensure, master's, doctoral. This is my 3rd university to teach in. So unless you pick out, electives, seek out something about American Indians, you're not going to learn, which is why we decided to do this book. And by we, I mean I. Because there's just nothing. I've been through the whole thing, and there's nothing. When I talked to the publisher, I said, there's nothing. He's like, what's your competition? I said, there's nothing. He's like, oh, surely there's something. He called me back 2 weeks later. He's like, there's nothing. I said, I Told you, there's nothing. So anyway, there it is. So what I learned, which you kind of know in the back of your head, but it's not really in your face, which it needs to be, is there were very targeted federal law policy against there's no laws and policies against any other group. In fact, the only group in the US Code is entitled, there are 25 entitled Indians. No other group has that. So anyway, there's the removal period, which you've all heard about, I hope, the Trail of Tears. Removal from the east for the good land and so forth. What they don't tell you is 4,000 people lost their lives moving. They took millions of acres. If a baby was crying, they take that, a soldier would take the baby and on a tree, and that's the end of that. They don't tell you that. And I can tell you they don't tell you that because my family lived in Connecticut, my previous job. My son went to school 2 miles from Yale. This is high school. And this is what he learned about the Trail of Tears, and I kid you not. The kindly soldier took the Indian family to a better place to live. 2013, that's what they learned about removal. Hidden. Everything's hidden to this day. Followed by the reservation period, which is not only to remove you, but you need to stay right here, and that's it. And back in the day, they would shoot you if you left. Then there's the termination period, which I told you about, when there were federal, and there's a whole case law bit that I won't get into, I don't have time, but it's the Marshall Trilogy, and it's in effect today for Indian law. And the termination period was when suddenly the martial law says there's a federal trust responsibility as you give us all this and we'll take care of you. They gave them all that and then they cut them, 100 tribes in the 50s. And then there's the assimilation period, which had the boarding school, residential schools. Are people familiar with that at all? Just a horrific time. Removing kids at 4 and 5, taking them away. They cannot dress the way they would dress. Their hair is cut. They shouldn't talk in their language, use their religion, etc. And then they go back home. If they ever get there, thousands are unaccounted for. They're in the ground. If they did get back, now they don't know their ways. Reintegration is almost impossible. The families that were there have sorrow and grief and shame that they left even though it wasn't their fault. This is historical trauma. It's called unresolved grief. And it hits today in everybody who's native through epigenetics. It's already been shown. So, what is that? It's trauma to your ancestors visited on you today. And then, as I just told you, highest murder rates, rape rates, injuries, alcohol, current traumas, and traumas from above. You're just getting a double whammy, and then people say, well, why can't they get it together? Why don't they stop drinking? Why don't they get off the meth? Just horrific, sustained, persistent, targeted measures to hide and quote-unquote get rid of the Indian property. So I last depressing parts here, and then I'll get a little better. I have, as my exemplar for all this, structural stuff. Mount Rushmore, which has gone by a couple times, I think. Does anybody know that that's a bad thing for Indians? So it would be bad enough if it was just that Mount Rushmore was, with no thought, carved forever into a sacred, you could think of it as church area in South Dakota. Can you imagine if you were just in your church or synagogue or wherever you are, and somebody comes butting in and puts some permanent structure that was the complete antithesis of everything you believed in, and said, tough, here it is, and then left. And then what are you going to do? So why it's been literally termed, like, let me get it right, because the 4 horsemen of American Indian apocalypse. Why do you say? Washington, each one of them, Washington ordered the massacre of the Iroquois throughout North New England. Are people aware of that? Lincoln ordered the biggest mass execution in U.S. to date by simultaneously hanging 38 American Indians in Mankato, Minnesota. It's called the Dakota 38 in 1862. Jefferson was the actual architect of the Trail of Tears. People think it's all Andrew Jackson. Andrew Jackson carried it out, but Jefferson was the architect, and he was heard over and over to talk about exterminating American Indians and get rid of the American Indian problem. And last but not least, Roosevelt has an infamous quote, "I wouldn't say I believe in the only good Indian's a dead Indian, but 9 out of 10 are, and I wonder about the 10th. It's a famous quote of his. And these 4 people are forever blasted into Indian country. And then again we say, well, why can't these people get over it? I don't even know if there's equal thing for the dominant culture. What could we put up that would be so horrific? We're trading with the $20 bill with Andrew Jackson, who's been named the Indian Killer, this is one of his nicknames, and Sharp Knife by the Indians. And you're forced to trade with it every day. How would you feel if the most horrific thing you can think of, you're forced to trade with, and if you're in South Dakota, you're seeing this, and if you open your book, everybody's saying, oh, isn't this wonderful, look at our presidents. You go to law school, oh, our forefathers. Nobody thinks what it's doing. How am I doing on time, by the way? Am I okay? So these are the reasons. Sustained, if I said it once, I'd love to say it 100 times. Sustained, targeted policies against American Indians. No other group in America has this same history. Nobody. And I can't remember if I told you did I write it? It's all a blur. The difference between 1870 and 1924. Anybody know what that is? 1870 is Amendment 15 of the Constitution that allowed blacks to have the vote. It wasn't until 1924 till Americans, Indians, gained citizenship throughout the country. So here are the first peoples, the last to gain citizenship. Now when I became a nurse, 1989, these people were in their 60s. Now they're the 70s, 80s, 90s. And we wonder why they don't have trust. Why don't they want to go to elder care, which became my dissertation question. Why don't they? Are you kidding? Why would they? But nobody knows. Does anybody know in aging? Does anybody know in healthcare? Does anybody know in primary, secondary, post-secondary schooling? Nobody knows anything. All they care about is, let's say, this could be politically incorrect, but I've been known to be Trump light every once in a while. All anybody cares about is the Redskins mascot. But I submit, you take care of those structural determinants, and that'll take care of things down the line. If you just hang out here on that tip, then you don't have to worry about this other stuff, do you? It's very easy. That's more the hiding. So the last thing I'll probably talk about, I could go on forever, but I won't. Oh, and there's my grandfather, the little boy, and my great-grandfather. They were in the Antelope Society. The last thing I'm going to talk about, you might have seen up here the medicine wheel. So now I'm going to turn to things that might be helpful. So what I tell nurses is we are already trained, supposedly we have in our tenets, to think of people holistically, which matches perfectly with the medicine wheel and the 4 domains of health: physical, spiritual, emotional, and mental. And if we really did what we say we're going to do, it wouldn't be so foreign to think about actually taking care of American Indians. So that's number 1. Number 2, you might see I had truck with its wheels blown out. It's a metaphor I heard in the Dakotas, and it spoke to me. And that is, those four wheels are those four domains. Now, if one of them got blown out, it would be a bumpy ride to health and through life. Two of them, really hard. And I tell you, in Indian country, four wheels are often blown out. And people are just like limping along to the sidelines. So we as nurses, doctors, other professionals need to recognize when a wheel is blown out. Fix it. See how many are blown out. But we never do. Take away whatever nails are in the ground. Figure it out. Those are the social and structural determinants of health. Only again, we treat people all the same. Oh, assimilation. That picture's me and my brother and sister. So I put that up there because as I stand in front of you, often people say, oh, are you, I just thought you were a white person or whatever. So again, that's sort of assimilation. You know, there you are, the kid. But after you've been in the schools and been in the professions and done this and done that, now you act, look, talk like everybody else, you know, so that's part of it too. Anyway, what I use that truck as an illustration of what is called trauma-informed care. It's one of my last points. You have to assume that every Indian person you meet, and as we are here in education, whether it's in the health setting or whether it's in education, that person has been traumatized. You can assume that. If they haven't, good. But 90% of the time, they've been traumatized, they know someone who's been traumatized, they're worried about being traumatized. And yet, we treat the student who somehow makes it over the transom in here, same as everybody else. Can't do that. Same with the patient. They come in, you treat them same as everybody else. Can't do it. My example there is if a person from the Pine Ridge, let's say, Reservation, South Dakota, the most desperate number-wise, if they were to come to me in Rapid City in a clinic, and they have diabetes, and I say, okay, take your insulin home, put it in the refrigerator, make sure your wounds are clean, and walk every day. I don't do anything else. I saw, did you understand this? Good, I did my job. Well, they go home, they're in a blown out single wide, they don't have a refrigerator, they don't have electricity. They might not have running water, they might be getting it from pails from a central place. They often are in Navajo. And they can't walk because of the res dogs, or there's no sidewalk, or it's dark out. So you didn't do anything for that person. Now on your paperwork, it all looks good. You did it legally, who's gonna get you? But what did you really do for that person? So, final comments are, we are still here. So that's a huge resilience, huge. After all the soldiers and mass killings, my tribe, once again, has the notoriety that it was the first case of germ warfare in America. My tribe is the one that had the smallpox on the blankets and wiped us down to almost nothing. So you get through germ warfare, everything else that's happened, targeted issues, and yet we're still here. So resilience, number one. If you're educating or if you're doing health, you have to go to that resilience. Number two, traditionality is very helpful. People have been here for millennia. Indigenous knowledge. You're gonna have to put things together. We have some examples of, I could only scrape up the last minute 3 medicines. But I have some tobacco, cedar, and sweet grass back there. Sage, I think I forgot the cedar. Anyway, traditional knowledge about medicine, about many things, about just living in America. They've been here for 15,000 years versus 300. They know something. So it's this knowledge, resilience, traditionality that kept them somehow going. And so those are the things educators and health professionals have to work with. Because of my law stuff, You have to go to your, your representatives and senators at state and federal level, say, why aren't we funding these people? Indian Health Service is really the first prepaid health plan. So they gave them millions of acres, and then they didn't take care of them. They breached the contracts. Indian Health Service takes care of 2.2 million American Indians and is funded at 40% need. It's also funded on the discretionary side of the budget versus the mandatory. And it's the only one that does, and it's the only one based in treaties. I don't even know how all this stuff happens. But anyway, my final, I keep saying that, but this is it, is unhide. Unhide the Indians, however you can do it. Get to the media. Submit something. Say something. Put something in a book. Do anything. Go to the schools. Primary, secondary, post-secondary, anything. Nobody says anything, nobody knows anything. So at least, since nobody says anything you do is something. So, unhide is my final thought. And I thank you for your kind attention.
Hi, my name is Linda. Have you bought a house in the area?
I have not.
Well, when you buy the house, if you look at the deed, it'll go back to the Holland Freedom Company. Because after the Revolutionary War, this whole area of Western New York was considered a protected area for those Indians you were talking about. And they were promised that there would be no white settlers. Did they keep their promise?
Do they ever?
Yeah. So they actually sold the land to the Holland Land Company.
Wow.
And the Holland, and every deed in this area will go back to the Holland Land Company that broke it up and sold it to all the white settlers.
Wow,
And then,
interesting.
if you would like, I would be glad to take you to Lakeshore Hospital in Irving, New York, that's connected right next to an Indian reservation. And so I'm sure the nursing staff in that area would like to hear some of this and probably tell you some things too.
Oh, I'm sure. I'm a newbie to New York. I freely admit it.
Anytime, I'd just like to take you out and introduce them to you. And I don't know, from making rounds there, I've been about 30% of their patients.
Oh,
Yeah.
yeah, sure. I'd love to explore
Yeah,
anywhere.
so there are rather large reservations in the area, and I would urge you to not only meet with heads of the tribes, but also the people. And like I said, I think that a visit to Lakeshore would be interesting for you.
Great, thank you. Anybody else? Chickens?
I vote for the Onondaga Nation, the Onondaga Tonight Plan, and what you say is true. If you don't stand up and make your peace with the people on the outside, I've had cases where I've had to intervene with a situation similar to what you talked about, the gentleman in the rundown shack and outside. So that young man paralyzed from an auto accident, same living conditions, and trying to get a nursing service to help him, dress these wounds and everything. They showed up the first day for the evaluation, walked out and said, he has no running water and we cannot come out this way to take care of him.
And yet somehow he's supposed to figure it out.
Yeah.
Yeah.
Yeah, but I mean, if you don't stand up and say, look, the bus line ends at our nation, it's 3 miles back. The chief lives on a rocky road, a very hilly driveway. There's no way a bus comes out there to pick him up to take him to PT. This is the reality of where we live. Somebody listen to what I'm trying to tell you. It doesn't work. Help us find a way so we can live. So if you don't advocate for your patients, and even if it's on an individual basis, then you're hiding. You're hiding.
Absolutely. That's a picture of my mother, by the way. Just for fun. Yes. Anybody else?
I was just going to comment as one of the few non-American educated people. I did have a module on American Indians in my history and all that was in England.
Yes, you did.
Believe it or not, it was part part of a broader American West, but there was one section that covered it. I'm sure it was all wrong, but it is covered.
Well, actually, I've heard that there's greater interest in Europe about American Indians and shame for the U.S. about how they treat. I hear that all the time. And Germans have this particular love of American Indians. I think they have it all wrong, but they have this fantasized view. But they're very much into American Indians. And then you come to the U.S. What literally, because I just went through this 4 times. What do you learn? You have, let's make the turkey hand at Thanksgiving and put on some feathers. In my day, I went to a Catholic primary school. Literally, I remember the chapters of the savages. I think that's gone now, at least in most states. You really don't learn anything of any import. So.
Thank you so much for many of these startling facts. I wonder, what is the role of the Indian Health Service? Are they helpful at all, or?
The Indian Health Service, and I worked for them for 6 years, so you do what you can, you know what I mean? People that work there, mostly, work there because they want to help with the health of this is the direct care workers, right? But it's the Congress that authorizes the money for Indian Health Service, and for whatever reason, it's at 40%. And I just told you 60% of Indians are now in urban areas. 1% of the already 40% is for urban Indian care. And again, it's discretionary, which means if there's a sequestration and all that shutdown, there's nothing.
But the Indian Health Service, according to the federal government, is a uniform branch in the United States. So they're actually paid according to the military, step increases. But the truth of the matter is, like the Marine Corps is not financed by discretionary funds.
Right. Well, there's 3 types of worker in Indian Health Service. So what you're talking about is the public health corps, what are they called? There you go, where the Surgeon General is the head of it. It's a uniformed, unarmed service. Unfortunately, this is mostly the physicians and whatnot, and as you get down farther. Then there's the civil service. Civil service is a large part of the nursing and whatnot. And then there's tribal hire. So it's all very complicated even to work within Indian Health Service because of all the, nursing itself has all the factions of LPN versus RN versus PSN and all that, and then throw in who's tribal, who's civil service, who's public health. It gets very complicated.
Could you talk a little bit more about trauma-informed care and what that looks like, and how Indigenous-based understandings of wellness come into your work, and how we can move towards good models of Indigenous wellness and nation-based?
Sure, I can give you a resource. I think it's SAMHSA that does it the most, has on their website steps for staff who are competent in trauma-informed care. What would that look like? You should have people, at least some, not all, but you should have people that are like the people you're taking care of. You should have people with similar history and culture so they can understand what you're taking care of. You should recognize, just as I told you, almost every American Indian is going to have some sort of trauma. It might not rule their day, but you're going to have to find that out by asking certain questions. They have 6 steps of trauma-informed care, and then like 6 steps of what would a competent in trauma-informed care person look like. So, as an example, I dragged my husband up to Toronto, and we went to the first and only ballet that is, he loved that, that was an Aboriginal ballet. It was from the Royal Winnipeg Ballet, and it was commissioned by the Truth and Reconciliation Committee up there in Canada, and they danced just incredibly, but they had a model of a residential school that was probably this big, it was pretty big. And the principal male dancer, who had been in their residential school, what we call our boarding schools, danced with it on his back and it kept crushing to the ground. And then he'd get up and it would crush him to the ground and then it'd get up. But if you just saw him on the street, you would have no idea that he was carrying this on his back until you start asking some questions.
I want to say thank you because yours is a voice that has not been heard in many years at the University of Buffalo. So thank you for being that voice and for sharing your perspective. And my question is, what advice do you have for young people, young Native people who desire to be agents of their own disability?
Yeah, right now, it seems that there's three things that people have to do, and I'm mainly looking at healthcare. So you reach back and anticipate somebody who might want to go in here. Right there. And then you provide mentoring, somebody who's been there, done it. Now that's getting a little, a scintilla easier. I think Marcia mentioned, I was literally the 13th, and I don't know if that's good or bad, the 13th American Indian to get a doctorate in nursing. That was in 2000, and I think we've only moved to maybe 22 or something. So, what was the question? Oh yeah, so mentor. Hard to find, but find some mentor, hopefully within culture. Secondly, students need to have a cohort. It's very difficult to be the quote-unquote lone wolf, because in everything you do, oh, is that what Indians do? Or everything you do, oh, can you speak for the Indians? Or what, you know, it's hard enough to go through school or plan your career without being the spokesman for your race. Most people don't have to do that. And then the third one is experiential. Take them over that threshold so they can see what a hospital looks like, or engineering, or theater, or whatever it is. So that it's not, if they don't have it in their head, they're gonna be afraid, they're not gonna know. But if you go, oh yeah, I've been here before, that's all right, I can do this. So mentoring, experiential, and a cohort, so you're not always the only one. So another thing I say about education is we always talk about the pipeline. So, you know, big idea is maybe have a program with these three things at one end, and then you go, whew, I'm done, and they'll come out the other end. No, it's not so much a pipeline as a sprinkler hose. And there's a million holes, and they come in and they go out, and they come in and they go out, and they come in and they go out. American Indians are often tied to place. They need to go back home and take care of things. Could be for extended period of time. American Indians have children at the youngest and more than almost any other group. So there's child care. There's sickness, as I just told you. If you only live to 49, your parents are going to be sick when you're in college, unlike other groups. So you have to think of all of these things. You can't just say, oh, let's get some Indians in here. You have to know what to do once they get there. Is that it?
Just one more. What is it that sustains you, Margaret? You've been a wonderful spokesperson for so long. What keeps you going?
What does keep me going? I think the way I grew up, so I'm from the three affiliated tribes, born in Fargo, but my father was with the VA. And so I lived, as I said, coast to coast, up and down all over. In my day, which I won't say when that was, but people lived on the grounds. So I literally lived in state after state after state, and a lot of them was where Indians were. So in Portland and Albuquerque and Minneapolis, you know, just all over, and I could see the different things. And I don't know, I guess it's the experience and the just the interest. I'm not sure, but it just really kind of grabbed me to see all the different people everywhere. Because I was struck when I did talk in Albuquerque, I don't know, it's all a blur now, February. There were a lot of American Indians in the crowd. It was the International Indigenous Women's Health Conference. And so many, even Native people, didn't know what I was saying. And it's because they were born there, they lived there, and that's what they knew. Now they could tell you, you know, chapter and verse about their own tribe, but they didn't have the bigger picture, and I think that bigger picture kind of helps me. Thank you.